The region that we will be focusing on today is the ankle for knee valgus impairment. So to begin with, we will first start with the static posture assessment, which is where I will have my client hold a regular stance as I observe for any misaligning indications on the body. I will specifically be focusing on the lower regions such as the ankle. So first off, we will look at the anterior static posture of my client. As we focus in on the lower region of the body, we clearly see valgus of the knees and foot pronation or flat feet. Now looking at a lateral static posture view, we see flexion at the knees causing a posterior pelvic tilt of the hips. We also see a bit of forward head posture in the superior region of the body. So finally, looking from a posterior perspective, we see obvious flat feet followed by the obvious knee valgus once again. So from the back side, the hips, shoulders, and head look in good alignment in comparison to the rest of the body. Next off, I had my client perform the overhead squat assessment, which will focus on those lower region impairments during transitional movement. So the client will begin with standing with their feet shoulder width apart and their head looking straight ahead, with their feet in neutral position. He will fully extend his arms and perform 5 squats in the anterior, posterior, and lateral view. The anterior view allows us to see foot pronation and knee valgus. From the lateral view, we are still able to see that knee valgus as well as pronation of the feet. The posterior view simply confirms that my client has a possible issue along his ankles due to the heavy pronation of the feet causing that knee valgus. Last of all, I will have my client perform a dynamic movement assessment known as the gait assessment. This is where he will simply have to walk on a treadmill, demonstrating any misalignments during dynamic movement of the body. Just from the posterior view alone, we can see that the feet turn inward as he walks, causing that knee valgus. So now looking at the obvious, which is knee valgus associated with the ankle region, we also look at what are the other potential causes for the impairment. First off, we have our overactive muscles, which include the lateral gastrocs, the peroneals, soleus, and the bicep femoris short head. As for the underactive muscles, we have the anterior and posterior tibialis, as well as the medial hamstrings. Other causes that could create flat feet, which leads to the valgus, includes pes plenis, which is a weakness of the medial arch of the foot, injury to the ankle joint, the genetics of the individual, and even the types of shoes that the person wears, such as sandals that are known for causing that weakness in the medial arch. So in order to improve on this impairment, we will incorporate some inhibitory techniques beginning with the self-myofascial release using foam rollers. First, I instructed my client to sit on the ground with his legs fully extended on top of the foam roller. First, focusing on one leg, he will place the resting leg on top of that one leg we will be working on. I have my client externally rotate his foot just to target that lateral gastroc muscle. He will perform this inhibition for 30 seconds. The reason why this muscle will be targeted is due to the fact that when this muscle is too tight, it will cause the tibia to abduct and rotate, influencing the femur to adduct and internally rotate. Next off, we will continue with the self-myofascial release using the foam roller on the bicep femoris short head muscle. For this muscle, I instructed my client to place the foam roller right underneath the hamstrings and again perform this inhibition for 30 seconds. This muscle was targeted due to the tightening causing more external rotation of the tibia. For the lengthening techniques, we focus on the gastrocnemius, as this was one of the tight muscles causing the impairment we were seeing at the ankles and knees. I instructed my client to place both hands against a wall while placing the right leg forward and his knee flexed and the left leg behind, fully extended. I asked him to hold this position for 30 seconds on both legs. Next, we worked on the soleus muscle, as this muscle aligns with the gastrocnemius, which also causes the tibial rotation, creating knee valgus. For this lengthening technique, I instructed my client to again place his hand against the wall, and this time place his left foot forward, meanwhile using a foam pad to place the middle of the right foot along the edge, causing a dorsiflexion of that right foot. He held this position for 30 seconds. In the activation techniques, we began by targeting the posterior tibialis. This muscle was important to strengthen just because it attaches to the navicular bone, which, if activated, will bring more support to the medial arch, reducing flat feet. I instructed my client to sit on the ground with his right knee flexed and the left leg extended. He will have to place his foot externally rotated and place the band along the distal region of his foot. He will have to go through dorsiflexion of the foot, performing 2 sets of 15 repetitions, increasing the intensity from 25 to 50 to 75 and finally to 100%. Also, we worked on activating the anterior tibialis, which also supports inversion of the foot, bringing that medial arch up and counteracting the posterior tibialis, causing that balance in the lower region. For this, I asked him to do the technique similar to the posterior tibialis, except he will keep the left leg in neutral position as the right leg is still flexed. He will also perform dorsiflexion of the foot, again performing 2 sets of 15 repetitions, increasing the intensity from 25 to 50 to 75 and finally to 100%. Last of all, there is the integration techniques. We begin with the single leg balance reach, which is a triplanar movement that maintains the base of support at one location. I instructed my client to reach with one leg as the other maintains the base of support for the body. He reached forward to the side and behind him, attempting to balance and, most importantly, incorporating all the weak muscles that cause knee valgus and flat feet. He repeated this 15 times under full control. Next, he performed a movement that moves the base of support through the step-up to balance integration technique. We used a step-up box as I asked him to step onto the platform with one leg, raising the opposite leg into hip flexion at 90 degrees and maintaining balance. He performed both legs at 15 repetitions under full control.